Good morning and welcome to this edition of For the Record. Today we're discussing how modern technology is changing the way the VA healthcare system is delivering their services. Today's guest is Harriet Browning, Chief Nurse of Fayetteville VA Healthcare System. Welcome to the program.
Thank you.
Thank you. I'm excited to have you come on to talk about telehealth. Exactly what is it?
Actually, what telehealth is, it's an ability to provide care using technology, and your provider and your patient are different geographical locations. So the provider is perhaps in Fayetteville and the veteran being seen may be in Goldsboro.
Very interesting. Is this a new trend we see in healthcare today?
Actually, telehealth started in probably the late 80s, early 90s with some different technologies. But as we move into the future, we are growing pretty substantially and expanding the use of the technologies to provide care.
Now, why did the Fayetteville VA healthcare system decide to bring this option to their veterans?
Well, one of the reasons that we use telehealth is because we can provide the specialty services to the veteran at the right time, in the right place, and also get the right specialty that may not be in Fayetteville, or it may not be in the veteran's rural location. For example, you can actually see a patient anywhere in the nation actually using telehealth systems as long as you have the technology available. And this opens up more access for our veterans. It decreases their wait times in many cases. And it also is quite a satisfier because they aren't traveling.
So the veterans like this concept.
They do like it.
Well, I'm excited. We need to make sure that our veterans are getting the best of care. We know this facility does that. The veterans get the quality care they need and deserve. And let's talk more about the various categories, I guess, of the various types of telehealth services. Tell me about home telehealth.
Home telehealth is a modality that we use. We put this device in the patient's home, and we have registered nurses that monitor the veteran and how he's doing. They're given a series of questions that they answer every day. For example, diabetes is a good example. That's a very challenging disease to manage. And these nurses are interacting with them on a regular basis and looking at their information on a daily basis, and then working with their primary care team so that they can help the veteran manage their own diabetes and stay at a level that's healthier for them. So that's the home telehealth model.
And that's very important. We know diabetes is on the rise. And it's good that the VA hospitals are ensuring that the veterans are being taken care of in this area.
Yes.
It's very, very good. All right, what about the clinical video telehealth? Tell me about that.
Clinical video telehealth is much like what we're doing right now. People can see us having conversation. And so we use equipment that allows, like Skype. You have a provider that's in one location and the veteran's in a different location closer to their home, and they have an interaction. It can be just a verbal interaction. For example, mental health is a great example of that. We do a lot of mental health where there's counseling sessions using telehealth. But there's more to it than that because we actually have peripheral devices that we can attach a stethoscope. And the provider who's 200 miles away can listen to that veteran's heart and lungs, or look in their eyes, or look in their ears. So it's a great vehicle to use to allow them to stay close to home and get the care that they need. And then the other component of video telehealth that's coming on now is called VA Video Connect, and that's where we're actually issuing tablets to our veterans. Many of our veterans have very complex, difficult to manage disease processes, but they have transportation issues, or if you have heart disease, sometimes just walking to the door will put you out of breath. So we're initiating a program now with our cardiologists where they'll have their patients in their home with this tablet, and they'll call them just like the clinical video telehealth, but the veteran's at home. And again, they have the peripherals. They can listen to their hearts. They can listen to their lungs. They can actually look at them and see, based on their color or those kinds of things, are they doing okay? Or do I need to bring them in? Do they need to go to the emergency room? This helps them stay a little more stable and hopefully keep them out of the hospital and at home where they need to be.
This is so exciting that technology today is advancing the way we deliver health care, especially to our veterans. And let's talk about the store and forward telehealth category.
That's basically taking images or gathering data. If I'll use the diabetic example again, that's probably one of the most common used store and forwards. Diabetics need their retinas in their eyes imaged every year or two. So we actually do those images in their own clinic, and then we secure them in our system and send them to a provider at a different location to evaluate them. So the optometrist in Fayetteville for the Hamlet patient will actually review those images, and then it goes back to the primary care team to report to the veteran what those images look like. So that's store and forward. We're also developing a store and forward modality for dermatology. So a veteran in Goldsboro will get a picture of something that has his or her primary care physician concerned that there may need to be some dermatology care. The image is taken, it's sent to the dermatologist. We do have one in Wilmington that works pretty frequently with these. He evaluates it and then reports back to that primary care provider, this is what you need to do with this specific problem. Not treat it with this, or they either need to come to me or go outside to have more intensive treatment done.
So everybody working together.
Yes.
For the common good of the patient.
Yes.
Now tell me about this. What other illnesses or conditions can be, I guess, utilized through these services? We mentioned diabetes, we mentioned heart disease. What other health problems can be addressed?
Well, essentially, if you can think about it and it's a disease process, you can probably do telehealth to help address it. Right now we have some CVT agreements going on with a transplant team, or actually 3 different transplant teams. One's in Iowa, one's in Houston, and one's in Pittsburgh. So the veteran needs a transplant, we'll just say a kidney transplant. And if Iowa is the kidney transplant center that they've been approved to get their transplant done with, the veteran actually comes in and can get that pre-work done. Obviously they go to Iowa for their surgery, but then their follow-up is done locally, either at Fayetteville or at their CBOC. So that's one of the options. There are hepatitis C opportunities for telehealth. We have done a bit of sleep management, sleep study telehealth, but we just continue to broaden those categories and do different things. As I said, if you think of the disease and you need a specialist in another location, you can obtain that. We are working on something right now with Camp Lejeune to do some endocrinology via telehealth to assist them, as well as our internal veterans in the VA.
This is making medicine better, and it's allowing the veterans to get involved in their own health care as a partnership with their doctors. Now, what type of equipment is needed from the patient's viewpoint to connect with telehealth?
Well, if you're doing it from home, like I said, we would provide a tablet for the veteran and teach the veteran how to use it. And then we would dial the veteran when it was time for the appointment, and all they do is push a button and answer. It's like FaceTime or Skype. And so then they can converse with their provider. If they're in a clinic for their visit, then we have technicians that help them, and they do all the connecting for them, and they assist on the patient side if the provider needs to listen to heart or lungs.
So it's exciting. It's very exciting. Many people might want to find out, well, is this secure? Everything's online. Is this a security issue in keeping their healthcare information private? Security issues.
That's certainly an understandable concern at this day and time, but the nice thing is that it's all within the VA secured system. We use our own medical record, and things are sent through that secure method, and then the store and forwards are through a secure method as well. Everything is encrypted, So it goes from location to location through an encryption with an internal VA connection. So it doesn't go out into cyberspace. It is all within, and so it's secure.
What about healthcare professionals, doctors, nurses? What do you like about this particular program? How does it make your job easier?
I think the best thing about telehealth is the fact that our veterans get the care they need and they don't have to travel long distances. We're very fortunate in North Carolina and in the Fayetteville system that we have a lot of different locations. Sometimes veterans may drive 20 or 30 miles, maybe 40, but in a lot of cases, we can provide that care in their home location. I'm based out of Wilmington. Wilmington's a 2-hour drive to Fayetteville, so instead of a veteran having to drive 2 hours to Fayetteville, they can drive to their Wilmington clinic where they get their primary care, and then the Fayetteville provider can provide the care via telehealth, and then they go back home. Or Jacksonville or Goldsboro, any of those locations can connect via telehealth, and the veteran's close to home, and there's no driving involved. It's safer for them. It's more pleasant for them. They don't have to do that drive. It's
making healthcare more convenient for patients, and I think when healthcare is convenient, people are more apt to get involved in their own healthcare because it's right there in their home, or they're right there near them. They don't have to drive a long distance. They can communicate with their doctor at home or virtually, or I think it's a win-win situation for anybody who wants to get involved in telehealth. And hopefully this is, or probably it's expanding into the civilian hospitals too. People probably across the country are utilizing these services, so this is something new.
It is expanding into the private sector. VA is kind of the forerunner on it, and we are still considered the world leader for telehealth. So it's a great opportunity.
It's a great innovation. So we'll come back to talk more about telehealth services and how the VA hospitals are impacting veterans' lives. We will be right back. Good morning and welcome back to the program. Today we're talking about telehealth services and how you can visit your doctor right in the comfort of your own home. Today's guest is Chief Nurse from the Fayetteville VA Healthcare System. She is Harriet Browning, and we appreciate you coming on the program to talk about this new concept. And you've got a gadget there that will tell us how people actually connect with their doctors through telehealth.
I do have a gadget. This is actually a gadget it's a stethoscope is what it is. And it's for use specifically with the home telehealth that I was talking about, where we do the video connect between the provider and the patient in their home. And this device, it's a stethoscope. On this end is a USB port. And the USB port plugs into the tablet that we provide to them. And then you just place the stethoscope on the chest. The provider can listen to the heart. They can listen to the lungs. And that helps these cardiologists evaluate exactly how the veteran's doing right now and determine, do I need to do something different? Is the veteran doing well? Is it an emergent situation? So that connection and being able to actually look at the veteran and see them, see their color, see how they're breathing, really does add to the ability to make sure we're managing their care appropriately and that we're taking the right actions to take care of them.
Interesting. Tell me how many veterans are actually using this program now?
The actual number right now, we've got 5 identified. We have not gotten the tablets into their home. We're starting the training process with the veterans. And once they're trained and are comfortable pushing the button to connect so that the provider can connect with them, We will be implementing it in reality. It's a conceptual idea, but we're very close. It should be within the next month that we'll have these in their homes and doing this. And that's just one example of identifying a disease process where we know that these veterans go in and out of the hospital. And our goal is to keep them out of the hospital for their sake. And so this is one of the things we said, well, if we're having that trouble, what can we do to prevent that? This was a great opportunity connecting telehealth and cardiology to do that.
That's great. The veterans love it. The doctors love it. The nurses love it. So it's a win-win situation for everybody involved in the healthcare system. Now, how does the service actually help the individual veteran out in the rural country manage his or her health?
Well, depending on the modality, if you're talking about the home telehealth where the RNs manage it, like I said, they're in constant communication with the veteran, either by reviewing their data that they submit themselves by answering questions on a device, or they call them and talk to them on the phone. They do education, they're motivational, they're like the coach and the cheerleader combined. And it's really nice because veterans, as they learn to manage their diseases, it feels good when you're doing something right and you get a good response from what you're doing, and it makes them feel good. And then at the point where they can self-manage, they don't necessarily stay on telehealth so that we can add other people in. Right now, if you look at our telehealth numbers, and this is all the categories, by the end of July, we had over 6,000 veterans that had received some type of telehealth care. Some of them do it repeatedly. Some of them, it's like with the retina scans, the images of the retina, that's once a year. But some of these sessions are multiple sessions, so it's pretty impressive when you look at the numbers.
You are the chief nurse of this healthcare system here in our area. What motivated you to get involved in nursing? I think it's a very noble profession.
Well, I became a nurse because I had a mother who was a nurse, and from the time I was probably big enough to walk, I was pulling her uniforms out of her closet, putting them on, and playing nurse in the home. And I went to nursing school and became a nurse in 1984. Yes, I'm that old. And have just done that. It's a very rewarding career. And not just being a nurse, when I went to work for VA, that became my service to the country.
And what is it like working for VA? Because, well, people who work in the VA system are very caring, passionate people, and they are taking care of our precious veterans. So how does this make you feel?
Well, my husband is a Marine. He says once a Marine, always a Marine.
It's true.
And he is not active duty, obviously, but he is a Marine, and my son is actually in the Army. I wasn't in the military, but this is my chance to give back to my country, to serve the veterans, the men and women that protect our freedoms and have served this country so valiantly.
I think it's great that the VA system, the VA hospitals are coming up with innovative ways to make healthcare more enjoyable, I guess if I can say that, or improve healthcare for our veterans. I think it's great that they're always coming up with ideas like the telehealth services. It's a very great concept. In your opinion, what do you think the long-range impact of telehealth would be on healthcare?
Well, I think telehealth is just going to continue to grow. I know in the Fayetteville system, we have some very specific things that we would like to see developed in the next year. One of those being in 2017, looking to see if we can implement some primary care where you have your provider in one location, and let's just say Dr. Jones, and that's just a name I threw out there, gets sick, and he's in Robeson. Well, he's got a whole group of patients that he needs to see, but he's sick, so he can't come to work. Instead of having to reschedule those veterans to come in when Dr. Jones is going to be there the next day or the next day or the next day or however long it's going to be, having a provider that can connect using modalities such as the stethoscope and do that primary care visit in his absence. If the veteran chooses to, they have the choice to say, no, I'd rather reschedule. But to have that opportunity to cover for that provider when he's sick and the veterans still get the care they need when they need it, where they need it, that's a great opportunity. So that's something that we'll be looking into for the next 2017 in trying to implement that. We'll have to do some evaluation of would it be the most logical thing to do financially and determine. We have the equipment, so it's not really an expense to buy more equipment for this particular modality, but making sure we have the right people so that we can provide that service.
Now, do the veterans tell you or give you suggestions on opinions of what they would like in their health care?
Some of them do. Some of them are very involved in their own care, and then there are others that are used to being told by healthcare what you should do, and that's something we're trying to evolve, both with telehealth and with our care services, our primary care services, is to have the veterans really take ownership of their health care. If it's what you want, then it's much more likely to happen than if it's what I'm telling you to do.
I think we all should be partners in our own health. You know, now, it's good that people are becoming more health savvy, and we are reading and doing research on health issues, because in the end, it's our bodies. You know, the healthcare providers, you can provide us with the health care, but it's up to us to maintain those bodies, which gets me to my next question. How does telehealth, I guess, help the patients manage in disease prevention or assist in disease prevention?
Right. The home telehealth program with the registered nurses, they actually have disease management protocols that they utilize, and they partner with the primary care team. So you've got your primary care team, and you have a provider and an RN and an LPN, and they're taking care of the veteran on a daily basis. But then those home telehealth RNs are working with them to educate and mentor and encourage the veterans as they move through their disease processes.
I think it's great. And we know many times our rural veterans have issues that maybe not apply to our veterans who live in the cities. So how is telehealth services really impacting those people living in those rural communities who cannot see their doctors all the time?
Interestingly enough, the literature supports, or the research that's been done shows that rural veterans are oftentimes more ill than urban veterans are. And so telehealth offers that opportunity to get care in their community, as opposed to having to travel. If I'm a farmer and I work all the time, it's a real hardship for me to travel 2 hours to get health care. If I can travel 30 minutes and go in and have a visit using telehealth, using the clinical video telehealth, and see a provider that's 2 hours away, get what I need in the right place at the right time, then I'm going to be much more satisfied and ultimately better managed and healthier.
There may be a veteran who's watching this program and is rather excited about telehealth services and would like to get involved in this particular program. Again, go over the benefits of telehealth services to a veteran.
The veterans can actually get care in their own community-based outpatient clinic with the specialist or the provider that they need to see at that time. So if you need to see an infectious disease doctor, go to your own clinic and you can connect with that infectious disease doctor. We're getting ready to implement a wound care clinic where we're using telehealth, and we have a wound nurse in Fayetteville. You have your wound, you're getting care for it. Well, instead of traveling to Fayetteville for her to look at it and treat your wound, she's going to work with the nurses in your own clinic in Jacksonville or Goldsboro and connecting via telehealth to say, okay, this is what's going on with the wound. Here's the treatment we need to use. Go ahead and apply that, and Mr. Jones, come back and see me in 2 weeks.
So it's really localizing healthcare in a very significant way,
Yes.
where people can stay right in their homes. What do you want people to remember about telehealth services?
Telehealth is a upcoming, growing opportunity. It gives us better access. It reduces our wait times. It's a satisfier. And I think you're going to find in the Fayetteville system that the program's going to continue to grow and offer more options for all the veterans.
Well, that's the key. Making sure that our veterans are taken care of. They work hard through their careers, giving of their time. They sacrifice so much for us. They deserve quality health care. And of course, they are getting quality health care here at the Fayetteville VA healthcare system. They really have a great staff here. The work they do is really impacting lives of our veterans, and we want them to continue to do the services here. That's all the time we have for this edition of For the Record. You're going to make it a super day. We'll see you back here next time.